Welcome to the Wise Senior. If you're here today, it likely means that someone you love has been showing changes that leave you feeling concerned or uncertain. Many people believe that passing in old age happens suddenly, but the truth is, the body often sends quiet signals, sometimes months or even a year in advance. The challenge? These signs are easy to overlook until it's too late. Today, we're going to discuss 5 early signs that an elderly loved one may be approaching their final stage of life. Some of these might be subtle things you've already noticed, but brushed off as normal aging. Others might seem small but indicate a much bigger change within the body. Recognizing these signs early allows us to provide better care, create meaningful moments, and ensure our loved ones spend their final months in peace, comfort, and dignity. Before we begin, I'd love to hear from you. Have you noticed any changes in a loved one that concerned you? Drop a comment below. Your experiences could help others who are going through the same journey. And don't forget to hit like and subscribe for more guidance on senior health and caregiving. Now let's dive in. Unexplained weight loss. A warning sign: unintentional weight loss is one of the earliest and most significant indicators that an elderly person may be in their final year of life. At first, the changes might seem small: clothes fitting more loosely, a belt needing extra notches, or an appetite that isn't what it used to be. Many families dismiss these changes as a natural part of aging. However, losing weight without trying is rarely a harmless sign. Instead, it often signals that the body is struggling to absorb nutrients efficiently, leading to muscle loss and a general decline in physical strength. As the body slows down, its ability to process food and extract essential nutrients diminishes. This can lead to muscle deterioration, making once simple tasks like walking, standing, or getting up from a chair increasingly difficult. With less muscle mass, seniors may experience balance issues, putting them at greater risk of falls and injuries. Additionally, a weakened immune system becomes a major concern. Without sufficient nutrition, the body struggles to fight off infections, leading to slower wound healing, increased susceptibility to illnesses like pneumonia or urinary tract infections, and prolonged recovery times. A decline in appetite isn't always just about food preferences or minor digestive discomfort. It often signals a deeper physiological change. Several factors contribute to reduced food intake in elderly individuals. As people age, their sense of taste and smell naturally diminishes, making food seem bland or unappealing. Favorite meals may no longer bring the same enjoyment, leading to reduced interest in eating. Some seniors even report that certain foods taste bitter or metallic, which can further discourage them from eating regularly. The body's metabolism naturally slows with age, meaning seniors require fewer calories than they did in their younger years. Additionally, digestive enzymes and stomach acid production decrease, making it harder to break down food efficiently. This can lead to feelings of fullness after just a few bites, further reducing overall food intake. Many age-related illnesses contribute to weight loss and reduced appetite. Kidney disease, heart failure, and liver dysfunction can all cause metabolic changes that lead to muscle wasting and fatigue. Neurodegenerative diseases, such as Parkinson's or Alzheimer's, may interfere with the body's natural hunger cues, leading to unintentional skipping of meals. Depression and anxiety, which are common in older adults, can suppress appetite. Seniors dealing with grief, loneliness, or a sense of isolation may withdraw from meals altogether, worsening the cycle of malnutrition. Medications also play a role, as many elderly individuals take multiple prescriptions that can affect appetite, digestion, or cause nausea. Certain drugs used for high blood pressure, diabetes, or pain management may contribute to decreased hunger or digestive discomfort, making eating a less enjoyable experience. If you notice a loved one eating less, appearing weaker, or losing weight rapidly despite encouragement, it's important not to dismiss it as just a normal part of aging. Instead, focus on providing nutritious, easy-to-eat meals that require minimal effort to chew and digest. Rather than large meals, offering small, frequent portions packed with protein, healthy fats, and vitamins can be more effective. Foods like eggs, Greek yogurt, nut butters, smoothies, and soft fruits are excellent options for seniors struggling with reduced appetite. Hydration is just as important as nutrition, as dehydration can contribute to fatigue, confusion, and poor digestion, so ensuring adequate fluid intake through water, herbal teas, broths, or diluted fruit juices can help prevent further decline. Beyond nutrition, The social and emotional aspect of eating should not be overlooked. Some seniors lose interest in meals simply because they eat alone or lack the stimulation they once had. Creating a positive mealtime environment by eating together, playing soft music, or presenting food in an appealing way can encourage better intake. Mild seasonings, warming up meals, or incorporating favorite flavors can help reignite interest in food, while in some cases, discussing nutritional supplements with a doctor may be beneficial. At this stage of life, comfort matters more than calorie counts. Forcing large meals can often lead to frustration and discomfort, so the focus should be on quality over quantity. Recognizing unintentional weight loss as a sign of the body's gradual transition can help families prepare emotionally and practically for the journey ahead. Ensuring their loved one receives care that prioritizes dignity, peace, and well-being. Deep, unshakable fatigue. One of the most profound and often overlooked signs that an elderly person may be nearing the final stage of life is deep, persistent exhaustion. This isn't the kind of tiredness that improves with a good night's sleep or a short nap. It's an overwhelming fatigue that lingers, making even the simplest tasks feel nearly impossible. You may begin to notice that getting out of bed requires immense effort. Something that used to be second nature now takes considerable time and energy. Walking across the room may leave them short of breath or visibly strained, and routine activities like getting dressed, brushing their hair, or even holding a conversation start to feel exhausting. It's not just physical fatigue, but a complete depletion of energy that doesn't seem to replenish, no matter how much they rest. This level of exhaustion happens because the body is gradually slowing down, conserving the little energy it has left for essential functions. As metabolism decreases, the body produces and utilizes energy less efficiently, meaning tasks that once required minimal effort now demand far more than the body can handle. At the same time, circulation weakens, reducing the supply of oxygen and nutrients to muscles and organs. This leads to frequent dizziness, muscle weakness, and a general feeling of sluggishness. The heart may not pump as strongly as it once did, making movement feel even more difficult. Blood pressure fluctuations become more common, which can contribute to feelings of lightheadedness or the need to sit down more frequently. Even digestion can slow, causing discomfort after meals, further reducing motivation to stay active. It's important to understand that this exhaustion is not just physical, it also has an emotional and psychological component. Many elderly individuals who have always been independent and active may find it difficult to accept that their bodies are no longer capable of doing what they once could. This can lead to frustration, sadness, or even embarrassment. They may withdraw from social activities, stop engaging in hobbies they once loved, or spend more time resting alone simply because they no longer have the energy to participate. For family members and caregivers, it can be heartbreaking to witness these changes, and the instinct may be to encourage movement, engagement, and activity in an effort to keep them going. However, in many cases, pushing them too hard can have the opposite effect, leading to further exhaustion, stress, and discomfort. One of the most meaningful ways to help during this stage is to allow them to rest when they need to, rather than expecting them to maintain their previous routines. Rest is not a sign of laziness, it is the body's way of coping with its gradual decline. Creating a comfortable and safe environment is equally important, as extreme fatigue can increase the risk of falls and injuries. Ensuring that their living space is free from trip hazards, that their bed and seating arrangements are easy to access, and that they have assistance when needed can make a huge difference in their quality of life. Offering emotional support is just as crucial. Simply being present, listening, and acknowledging their frustrations without judgment can provide immense comfort. Small gestures like holding their hand, sitting with them in silence, or engaging in light, meaningful conversation can offer reassurance and remind them that they are not alone. If your loved one is sleeping more, struggling to keep up with daily activities, and showing a noticeable decline in energy, recognize that this is not just a temporary phase, it is the body preparing for a slower pace. Understanding this can help families shift their focus from trying to fix the exhaustion to making their loved one's remaining time as comfortable and peaceful as possible. Sometimes the greatest gift you can give is simply allowing them to rest, ensuring they feel safe, supported, and surrounded by love. Increased confusion and emotional withdrawal. One of the most heartbreaking changes families experience as their elderly loved ones approach the final stage of life is cognitive decline. Even if they have never been diagnosed with dementia or Alzheimer's, subtle yet significant shifts in memory, comprehension, and engagement can become apparent. A person who once recalled details effortlessly may start forgetting names, dates, or past conversations. They may struggle to keep track of events, asking the same questions repeatedly without realizing they have already been answered. What was once second nature, remembering appointments, recognizing familiar faces, or recalling recent discussions, becomes more difficult, leaving both the individual and their family members feeling frustrated and confused. Another distressing change is difficulty navigating familiar surroundings. A loved one who has lived in the same home for decades may suddenly forget where they placed items or even become momentarily disoriented in their own neighborhood. This can be alarming, especially for family members who are not expecting such changes. Along with forgetfulness, their ability to follow conversations may decline. Where they once engaged in meaningful discussions, now they may struggle to keep up, lose their train of thought mid-sentence, or have trouble expressing themselves clearly. Words that once came easily may take longer to retrieve, leading to pauses, repetition, or incomplete thoughts. For some, this can create frustration, leading them to withdraw from conversations altogether rather than risk embarrassment. These changes happen because, like every other organ in the body, the brain depends on oxygen and nutrients to function properly. As circulation slows and the body's systems start to conserve energy, the brain is no longer receiving the same level of support it once did. This results in a noticeable decline in cognitive ability, even in individuals who previously had sharp mental faculties. In some cases, these changes can fluctuate. There may be days when your loved one seems alert and engaged, followed by periods of confusion, forgetfulness, or withdrawal. This inconsistency can make it even more difficult for families to understand what is happening and how best to respond. Beyond memory loss, many elderly individuals nearing the end of life also experience emotional withdrawal. They may become noticeably quieter, less engaged in activities they once enjoyed, or uninterested in social interactions. This is not necessarily a sign of depression, but rather a reflection of the body's shifting priorities. Conversations that once felt natural may now seem exhausting, and the presence of too many people or too much activity may feel overwhelming. They may prefer to sit in silence, stare off into the distance, or spend more time resting alone. It is important to understand that this withdrawal is not personal. It is simply the body's way of conserving energy and preparing for the transition ahead. So how can families and caregivers help during this time? The most important approach is to meet them where they are. If they struggle to follow conversations, slow down, simplify your words, and allow them the time they need to process and respond. Avoid correcting them if they forget details or repeat themselves. It is more important that they feel heard and understood than that they recall facts accurately. Create a calm and familiar environment to reduce confusion and provide a sense of stability. Keep their surroundings uncluttered, limit unnecessary noise, and ensure that essential items, glasses, hearing aids, personal belongings, are easily accessible. Gentle, reassuring engagement can make all the difference. Even if they no longer respond as they once did, your presence still matters. Holding their hand, sitting with them in comfortable silence, or reminiscing about shared memories in a soothing tone can provide comfort. If you begin noticing these changes in a loved one, do not brush them off as just aging. While some level of forgetfulness is normal with age, sudden or significant cognitive decline may be an early sign that the body and mind are preparing for a transition. Recognizing these changes allows families to adjust their expectations, offer compassionate care, and cherish meaningful moments while they still can. Rather than focusing on what is being lost, find ways to ensure that their remaining time is filled with patience, love, and dignity. Frequent infections and slower healing. Have you noticed a loved one getting sick more often? Maybe they seem to catch every cold that goes around, or they struggle to recover from even the mildest illnesses. It might also be that minor cuts and bruises take much longer to heal than they once did. These are all signs that the immune system is weakening, an expected but often overlooked part of the final stages of life. As the body begins to conserve its remaining energy, its ability to fight off infections diminishes. What used to be a simple cold or minor wound now lingers for weeks, sometimes leading to more serious complications. One of the most concerning aspects of a weakened immune system is the increased risk of infections. Pneumonia, urinary tract infections, UTIs, and skin infections become far more frequent, sometimes appearing without the usual warning signs. Pneumonia in particular is a leading cause of complications in elderly individuals, often developing suddenly and progressing quickly. UTIs, which may have once caused discomfort or pain, can now present in unexpected ways, such as sudden confusion, extreme fatigue, or unsteadiness. Skin infections and slow-healing wounds become a challenge as circulation declines, making it harder for the body to repair itself. Bed sores, common in those who are less mobile, can also develop and worsen if not carefully managed. Another major issue is that antibiotics may not be as effective as they once were. Infections that used to clear up with a short course of medication may now linger, requiring stronger treatments or multiple rounds of antibiotics. However, frequent use of antibiotics comes with risks, including resistance, side effects, and added strain on the body. At a certain point, aggressive treatment may no longer be the best approach. Instead, the focus shifts from curing illnesses to providing comfort and preventing unnecessary suffering. So what can you do to help? First, keep them hydrated. Dehydration weakens the immune system further and makes infections worse. Many elderly individuals naturally drink less as their thirst response diminishes, so encouraging small, frequent sips of water or electrolyte-rich drinks can help. Good hygiene is also crucial. Regular hand washing, oral care, and keeping their living space clean can reduce exposure to harmful bacteria and viruses. If they are bedridden, repositioning them regularly can help prevent bed sores and infections. Equally important is knowing when to prioritize comfort over aggressive treatment. When the immune system weakens significantly, the body may no longer respond well to strong medications or hospital interventions. Instead of putting them through exhausting treatments, focus on comfort care. This could mean managing symptoms at home, using gentle pain relief, and ensuring they feel as comfortable as possible. Simple measures like keeping their room cool, offering soft blankets, and using soothing lotions for dry skin can make a big difference in their quality of life. Another crucial aspect is learning to recognize silent symptoms of infection. Unlike younger individuals, seniors may not always show a fever or obvious signs of illness. Instead, sudden confusion, extreme tiredness, or loss of appetite might be the first clues that something is wrong. Being aware of these changes allows you to respond appropriately, whether by seeking medical advice or making adjustments to their care routine. At this stage, the goal isn't to fight every illness at all costs, but to reduce suffering and enhance comfort. Understanding that the body is going through a natural transition can help families make decisions that prioritize dignity and peace over unnecessary interventions. Instead of focusing on eliminating infections entirely, focus on keeping them comfortable, well hydrated, and surrounded by love. By recognizing these changes early and adjusting care accordingly, you can provide the best possible support for your loved one in their final stage of life. Irregular breathing and poor circulation. As the body approaches its final stage, one of the most noticeable changes occurs in breathing and circulation. You may observe slow, shallow breaths, sometimes with long pauses in between. This irregular breathing pattern, known as Cheyne-Stokes respiration, is common in the later stages of life. The individual may breathe deeply for a period, then stop for several seconds before resuming. While it may appear distressing, it is part of the body's natural process of slowing down. In addition to breathing changes, circulation also begins to decline. Hands, feet, and even the tip of the nose or ears may feel unusually cold to the touch. The skin may take on a pale or bluish tint, particularly around the extremities. This happens because the heart is no longer pumping as strongly, and the body starts prioritizing blood flow to essential organs like the brain and heart, while reducing circulation to the limbs. As these changes progress, shortness of breath can become more noticeable, even when the individual is at rest. Simple activities such as sitting up, shifting positions, or speaking may leave them feeling breathless. Some may develop a persistent cough or experience a gurgling sound while breathing. This occurs because fluid begins to accumulate in the lungs, making it harder for air to pass through. Many mistake this congestion for an ordinary respiratory issue, but in reality, it is a sign of the body gradually shutting down. At this stage, some individuals may prefer to sleep propped up on pillows rather than lying flat, as it makes breathing slightly easier. For loved ones witnessing these changes, it can be an emotional and challenging experience. The instinct may be to encourage deeper breathing, reposition them frequently, or even seek medical intervention to address these symptoms. However, it is important to understand that these changes are a natural part of the dying process and cannot be reversed. Instead of trying to fix the situation, focusing on comfort is the most compassionate approach. Ensuring that they are in a relaxed, well-supported position can help ease breathing difficulties. Keeping the head slightly elevated with pillows or adjusting their posture to allow for better airflow can provide relief. If dryness or irritation is an issue, using a humidifier or applying a small amount of moisture to their lips and nostrils may help. Beyond physical comfort, emotional support is equally important. A calming presence can make a significant difference in their experience. Speaking softly, holding their hand, or simply being present in the room can bring reassurance and peace. Even if they are unable to respond, hearing familiar voices and feeling a loved one's presence can offer immense comfort. Anxiety or restlessness is common during this phase, and a soothing environment, free of loud noises and unnecessary stimulation, can help create a sense of tranquility. While these changes may be difficult to witness, it is crucial to remember that they are a natural part of the body's transition. Understanding what is happening allows caregivers and family members to respond with patience and compassion, rather than fear. Instead of focusing on medical intervention or trying to prolong life, shifting the focus to making their final moments as peaceful and comfortable as possible is the best way to support them. A warm touch, a soft word, or simply sitting beside them in silence can be more powerful than any treatment. These last moments, while heartbreaking, can also be a time of deep connection, love, and letting go with grace. One of the most profound lessons from this discussion is the importance of recognizing and accepting life's natural transitions. Aging is a journey filled with changes, and while some may be difficult to witness, understanding these shifts allows us to prepare emotionally, physically, and spiritually. For seniors and their loved ones, being aware of the body's signals, such as fatigue, cognitive decline, or changes in breathing, can help in making informed decisions about care, comfort, and emotional well-being. Another key takeaway is that quality of life matters more than prolonging it at any cost. In the later stages of life, the focus should shift from medical intervention to ensuring dignity, peace, and comfort. Small acts of kindness, holding a hand, speaking gently, creating a calming environment, can bring more relief than aggressive treatments. This is a time for cherishing relationships, expressing love, and embracing moments of connection. Lastly, for caregivers and family members, it is important to practice patience, compassion, and self-care. Supporting a loved one through this stage can be emotionally draining, but by approaching it with understanding and acceptance, we can ensure that their final days are filled with warmth, respect, and love. Now, I want to hear from you. Have you noticed any of these changes in a loved one? Share your experiences in the comments. Your story might help someone else going through the same journey. If you found this video helpful, please like, subscribe, and turn on notifications for more guidance on senior health and caregiving. Thank you for watching. Take care of yourself and your loved ones.